Hey, my name is Jeff Lienberger. I'm the Executive Director of the Dream Center Clinic, and I am so excited to be here with So Exquisite magazine. And we've started the Dream Center Medical Clinic in 2009 here in North Charleston. We started the Dream Center, which is an outreach component of our church. We started handing out food and clothing, and we had a ministry called Adopt a Block where we went out into the community and basically started creating relationships with the people that lived in this community. At the time when we moved into this community, we were 9th highest crime rate in the United States per capita. And so it was a rough area. And so it was an area that we felt that we were called to, that we could come alongside of the community and help out in any way we could. We started with food and clothing, like I said, and then we noticed that there was a need for medical care. And we had a few physicians that came to our church that approached us about starting a medical clinic, basically with primary care. And so about a year of planning that went into that, and now almost 7 years later, we're seeing over 6,000 patients for not only primary care, but 12 different types of specialty care, a neurology clinic, a dental clinic, and a vision clinic. I moved from Southern Ohio to Charleston in 2004. And my wife and I hadn't started a family yet, and we were trying to test the Charleston area, and we went to various churches in the community, and I actually got stuck in an airport on a delayed flight, and there was a gentleman sitting next to me who was telling me that they had a very similar story that I did, and they moved to Charleston, and they were getting ready to start a family, and they started going to a church called Seacoast Church. And I was raised Catholic, but my wife was not raised in the church at all, so we were looking for something that fit both of our needs. And I remember walking into the Mount Pleasant campus. We have 12 campuses at Seacoast, and I walked into the Mount Pleasant campus, and being raised Catholic, I'm used to a solemn kind of feel and quiet, and there were drums on stage and guitars on stage, and I was like, what is going on here? It was something that I wasn't used to at all. And we absolutely fell in love with the place, and it was just, you come as you are. It was everybody was very friendly, and it was just a place that we both connected, and we could begin our journey together, so to speak. And after about 4 years of attending the church, my wife was very involved in the community and even did some global outreach. She went to Nicaragua on a mission trip, and I was having trouble fitting in. I was working for a large healthcare company nationally, traveling around to hospitals, implementing software that basically made hospitals more efficient and helped them save money. And so I was in the corporate world for a long time. And one day I was sitting at church, and they had a promo coming on. This was in 2009. And they were asking if you had a medical background and you had any interest in helping a free medical clinic get on the ground, to come to an information meeting. Well, that was in November of 2009, and I went there for the first time for that meeting, and something just hit me about this place. I'd never been to North Charleston. I was living in Mount Pleasant. North Charleston was foreign to me, which is only about 9 miles from Mount Pleasant. But I connected with this church, and I connected with the outreach and the mission that they were helping others in the community. They weren't coming in telling them what to do, but they were coming alongside of them and just creating relationships. And it was something that I wasn't used to in the past. And so I started volunteering here. I was working a full-time job at Roper Hospital, which is a local hospital here in Charleston, and I served here every Tuesday and Thursday night. And you know, there were days where I would work 9-10 hours a day, and I was tired and I wanted to go home, but something called me here, something pulled me here, something I really can't even explain. And so I started growing in my walk just in this place with all of the ministries that were going on, and I just knew that there was something more for me. And so I didn't know what that was, and I was very nervous about what that was, but I knew something, God was calling me to this place. And so the gentleman, Bill Barticini, who started this medical clinic in 2009, approached me and said, hey, I'm going to be retiring at the end of the year. This was in February of 2013, and said, I'm going to be retiring at the end of the year, and we would love for you to take over. And I didn't know what that looked like. I didn't know how that was going to be possible, coming from the corporate world into a nonprofit arena. It was confusing. It was scary. And then 2 weeks later, I walked into the clinic, and a group of people, the pastor that was here at the time and Bill, who was running the clinic at the time, I walked into the room and it was like a record scratched, and they all stopped talking and they looked at me, and I was like, "What's going on, guys?" And they said, "Well, Bill is expediting his departure, and he wants to move in 2 weeks, and we'd love for you to take over the clinic." And so I was faced with a decision to make. I just had my first child. He was just about 2 years old at the time, and I was working in a corporate job, and they were asking me to basically leave my corporate job to come and take over the medical clinic. And so I took a couple days and talked about it with my wife, and we prayed about it, and I just felt a nudge to go for it. And again, we didn't know how it was going to work out, but we did it. We made the change, and at that time we were seeing about 2,000 to 3,000 patients a year, and kind of one of the initiatives was for me to help grow this clinic because there was such a need. And this was when the Affordable Care Act was coming into play, and there was a lot of confusion about what was going to go on in healthcare in the United States. And so we took it over, and we started expanding our hours and expanding our operations, and we went from about 3,000 patients to 6,000 patients in about 2 years, just really making an impact in the community. And I don't know what to tell you that happened in my life, but to go from a corporate job that wasn't really even connected in a church to being involved in this ministry that serves so many people in the community, it could only be a nudging from a higher power. Here at the Dream Center Clinic, we made the decision early on that we wanted to treat the people that were in the most need. And so our requirements to see patients here in the medical clinic originally was you had to live in North Charleston and Hanahan, and you had to be 200% of the federal poverty level with no access to insurance. So if you had Medicare and Medicaid, you were covered under the hospitals. If you had private insurance, you were covered under the hospitals. But we wanted to treat those that had no means to get care whatsoever. And so those are our criteria to be seen here at the medical clinic. And just recently, about 6 months ago, we've opened our territory up to West Ashley. So now we see West Ashley, North Charleston, and Hanahan for medical, primary care, specialty care, and dental and vision as well. Our clinic runs, it's a 100% free clinic. There's no charge to the patients whatsoever. And so we have about 100 volunteers that serve here at the clinic, and that's a combination of doctors and nurses and mid-level providers such as nurse practitioners and primary care, physician assistants. We also have people that work the front desk just like you would in a normal doctor's office. We have social workers. Again, and all of these people come out and give of their time and their talent, and they're 100% volunteers. And so if that's something that you might be interested in doing, we're always in need for physicians, nurses, and lay people to come and help us. And you can simply help us do that and by getting more information by going to our website, which is www.dreamcenterclinic.org, and there's a place where you can click on there to get all the information to become a volunteer at the Dream Center Clinic. We treat patients basically with primary care and specialty care needs, but sometimes we do run into situations where a situation arises where the care requires something outside of what we do here. And I think of a couple of examples. We had a young boy, he was 19 years old, and he was diagnosed with stage 4 lymphoma. And we were able to, he was seen here, treated here initially. I was talking to his mother and I said, why hasn't he gone to the hospital? He looked sick. And she said, well, he was waiting until November so he could reapply for Obamacare. And they lived 2 miles down the road, and they had no idea that we were a free medical clinic. She actually happened on this place because she was donating some supplies that someone said that we were taking some supplies. And she brought him in the next day, and sure enough, our doctors looked at him immediately and knew that he had something chronic and something that we couldn't deal with here. But we were able to contact our networks in the community. They were able to, so he came in on a Tuesday. On Friday, he was already having surgery at MUSC Hospital, and then subsequently has gone through chemotherapy through one of our local affiliates called CHOA, which is Charleston Hematology and Oncology Associates. And but if it weren't for a place like the Dream Center, and he would have waited until November, his prognosis wouldn't have been as good as it was. And now he is 100% cancer free after about 1.5 years of networking and navigating through the health system. We've had emergency situations where people have come in, they've been mugged, they've had instances where we've had our own doctors drive them down to the emergency room, and they've been able to get surgery and recover from that. And so the impact that we're trying to make on this community is we're trying to keep as many people out of the emergency room as possible, because the average cost of an emergency care visit is about $1,200. Our average cost is about $25. So there are needs that arise that we can't handle in here, but some of the chronic diseases such as hypertension and diabetes, that's where we really want these people to come, is so that we can keep them out of the emergency room where there's higher cost and it jacks up the cost for the rest of us. We want to be able to treat those people here so that they can receive quality care. So the Hope for Healing Walk came about just 3 years ago. As we continued to grow as a free health clinic. Again, we're 100% free, so we have no revenue whatsoever. So grants became a little bit more difficult to come by. So we knew that there needed to be another avenue that we could take in order to meet the needs of the growing needs of the community for free health care. And so 3 years ago, we started Hope for Healing Walk, which is a 1.5 mile walk around Park Circle here in North Charleston. And most events that you go to or you participate in, they charge you a registration fee, and there's fees for the walk, and then you come out and there's different things. And we didn't want to do that. We wanted to raise money, obviously, but we also wanted to create awareness around what we do here at the medical clinic. And not only that, but we didn't want just people that could afford to come out to an event to come to the event. We wanted our patients to come. We wanted volunteers to come. We wanted doctors to come. So it's a fundraiser, and this sounds weird, but it is a free event. It's entirely free. So if you want to come out and walk and join in the festivities, you can do that at no cost. But how we raise money is we try to raise awareness about what we do at the clinic. And so I would register as a walker for free, and then I would ask my friends and family to donate as a sponsor for the effort that I'm making in walking the 1.5 miles. And so the first year we were able to raise about $75,000, which is 80% of our operational budget. Last year, unfortunately, was during the 100-year flood, and so we had to cancel that event, but still we're able to make about $40,000. And so this year we're doing the event again. Our goal is $100,000. And it's called the Hope for Healing Walk, and you can sign up at www.dreamcenterclinic.org and click on the Hope for Healing tab. Again, it's going to be a fun event. It's a short 1.5 mile walk around beautiful Park Circle. And then when you end up at the walk, we are going to be actually doing a free health screening. So our doctors and volunteer doctors and nurses will be there doing skin cancer checks, blood pressure, glucose checks, and a variety of other things. We're also going to have a DJ. We're going to have free food. We're going to have Chick-fil-A again this year, along with 2,000 hot dogs. Who doesn't love hot dogs? And we're in the works right now of doing a free farmers market as well. So we're excited about this event. And again, it's twofold. It is a fundraiser, so we do like people to help us raise money. And if you are able to raise $200, you will get a free t-shirt. But if you can't raise the money, or if you don't have the money, we still want you to come out and celebrate the 6,000 patients that we were able to treat this year. Just going to be a fun event. We want the entire community to be there. If we've got 10,000 people there, I will be extremely happy. It's just going to be a fun event.